welcome. Thank you so much for coming to this beautiful venue. Thank you, Patty, for helping organise that. What a beautiful, beautiful day. So we're here to share the work of the Climate Health Coalition, to give you a sense of what we're trying to do with the coalition, to share some of our recent work. In order to do that, I have a brilliant lineup of beautiful people who are our panelists. We have Glyn from Bupa, Kate from the Governor's Office of New Jersey, the Climate Office. We have Henri Moore, Head of Responsible Business for Haleon, Josh from Healthcare Without Harm, David Croft from Reckitt, who have helped make this whole event possible, and then you're so far away. Hey, Una. Una, VP of ESG and DEI at Walgreens Boots International. So this is our wonderful panelists. Just to set the context for the discussion, why climate, why health right now? As Forum for the Future, we are the conveners of the Climate Health Coalition. We've been really interested in this intersection of climate health for a few years now. Back in the Hunger Week of 2019, we contributed to a report that was pulled together by the United Nations Global Compact, Healthy People, Healthy Planet, because it's really struck us for a while that what a marvelous opportunity to drive integrated action at that climate and health interface. And it's also really clear to us that the private sector in particular has an incredible opportunity to drive accelerated action on both those two issues. Since 2019, of course, we've now had more recently the IPCC report really calling out the links between climate and health. Climate change will manifest itself as a public health crisis. And it's become clearer and clearer that the private sector has a role to play. And so building on a guidance document that we published with all of these wonderful people a year ago at Climate Week last year, guidance for the private sector to drive action on climate and health, we formalized that partnership in the shape of the Climate and Health Coalition, which is supported by the four corporates we have here on the panel. And the purpose of the coalition, very simply, is to unlock private sector action at the interface of climate and health. And our focus this year has got two prongs to it. We are updating the guidance that we produced this time last year, and we're also building out a wider call to action aimed at policymakers, investors, all of the other actors in the system that have a role to play in creating an enabling environment to really unlock the potential of the private sector, which is why it's brilliant to have Kate on the panel with the policy perspective, and Josh with Healthcare Without Harm has got a long history in working in this space. So between the six of us, seven, I can't even count today. We are hopefully going to share some insights from the updated guidance, give you a sense of the bones of the call to action, and hopefully if we get time, come to you, the audience, and take any questions that we might have. We are filming this event. Even though it's really sad to see empty spaces, we were massively oversubscribed. So thank you for coming. We really do appreciate that. But we are filming the event because we had a lot of interest. So you won't get filmed personally, but if you do ask a question, just be mindful that it will be recorded. But don't let that put you off in any way, shape, or form. So without further ado then, I think we'll kick off with a question to the Climate and Health Coalition partners, and I'm going to just go down the line in a very sort of linear fashion. My question to the four of you in turn is, why did you want to get involved in the Climate and Health Coalition, and what do you see as the contribution of your organisation? Glyn.
Thank you, Sally. Just a quick, first of all, good morning. Thank you for coming. Secondly, just a quick intro to who Bupa is, because I'm conscious we're not particularly present in the US market. So Bupa is a healthcare company. We've been around for about 75 years. We're headquartered in the UK, but we have operations in Europe, Australasia, the Middle East, Latin America, Hong Kong, and a few other territories as well. So we're relatively global, but not in the US or Canadian market. We employ about 85,000 people across those locations. So we're relatively large, and we cover both health insurance and also health provisions. That's clinics, dental clinics, hospitals, and also aged care in some places. So I think for us, as a healthcare company, our fundamental purpose is to help people live longer, healthier, happier lives. And also we updated that recently to sort of say, making a better world. So we do look after people's health. And I think we realized quite quickly that you can't do that unless you also look after the health of the planet. So there is this natural intersection between health of the people and the health of the planet. We recognize that those two things are interconnected and interdependent, and healthcare is that pathway to sort of providing for both. And so when we were looking at kind of what role do we want to play, we very much saw ourselves as agents for change in terms of how we drive that kind of intersection, because we do recognize that healthy people need healthier planets. Our role, therefore, is kind of really to address the impact of healthcare on the planet, and also to find healthcare solutions that make the healthcare system, much more resilient. So to be able to do that, we have to understand how the provision of healthcare impacts the planet, and also how the planet impacts people's health. And that's very much kind of where we are focusing. We also recognize that we need to educate and advocate for a healthier world in some parts of the places we operate. And to do that, we want to sort of also create healthier, greener spaces for people where they can thrive. And that's therefore a very kind of core part of what we want to do. And that's really sort of guided our strategy, which I'll talk about hopefully a little bit later. But the thing we've realized when we tried to sort of really make some inroads in this space is that collaboration is absolutely key. And I'm sure you'll hear this from various people today and across the whole of New York Climate Week. Doing this on your own is basically, it's very, very hard, if not impossible. You have to collaborate. And that's where operations or coalitions like the Health and Care Coalition really come in. So it's a really exciting kind of opportunity for us to be part of that coalition and to identify the opportunities for change and action and help drive that change and action. We also really want to sort of equip the private sector to drive that change. So whilst policy is important, I think action across the private sector is fundamental. You cannot deliver on the ambitions for climate change or addressing climate change unless you are taking action as the private sector employer. And so the contribution we feel we can make to the coalition and also the conversation on climate change is bringing our clinical voice. We employ lots of clinicians across lots of different territories. We do see the impacts of climate change through our funding and also healthcare provision activities. And so we kind of really feel like we understand the impact. And that's very much where we want to sort of bring that kind of practical experience of how are clinicians facing into this, what are the actions that we can take as clinicians, and how does that impact things like care pathways, the way we design products and services for people. We also recognize that, frankly, we're not experts. This is all kind of relatively new for us. And that's where the opportunity for us to learn from fellow panelists up here, other members of coalitions, and also, frankly, other coalitions themselves. We're hungry to understand more and more so we can really start to drive and inform our own strategies and actions. And therefore, it's really key that we collaborate in that way.
Thank you very much. And yes, we'd love to hear more about your new strategy, which is a really ambitious strategy, really looking at the intersection of climate and health and nature. So thank you, Glyn, and great to hear that focus on all those clinicians that form the backbone of Bupa. So same question to you, Henri, if I may.
Yes, so Haleon is a new company. We were born like a 21-year-old child because we are a demerger from GSK. We were the consumer health division. So we launched with iconic brands of Advil and Otrivin and Centrum. So as we built this company, it's been about a 3-year journey. I just started this past October. But it was really with the purpose of really generating better everyday health for humanity. That's our purpose. And we really want to activate around environmental and social inhibitors that stop people from having better everyday health care. And as a company, I think we always knew the climate and health connection. When you look in the world now, 90% of the people in the world breathe air that's polluted. And that's, less than the standard recommended by the World Health Organization. There are millions of people that die every year from just pollution around the world. So we always knew that connection existed. So I think, we all know when we speak about collaboration, you can't do it alone. You need a coalition of the willing to really move the needle on things. So we as a company will work on healthcare, we'll work on barriers to health, literacy, accessibility, as well as really tackling bias and prejudice. I handle responsible business, community investment is in my wheelhouse. And those are the programs that we will be doing will go directly against those barriers. So we're happy to be a member of the coalition to work with other companies that are enlightened and trying to move the needle forward.
Thank you very much indeed. David from Reckitt, same question. What made you want to be part of forming this coalition?
Thanks, Sally. Reckitt is a global health, hygiene, and nutrition business. And whilst you might not necessarily recognize the name Reckitt, I guarantee you will recognize our brands here in the US, particularly after the last 2 years, Lysol, but also Enfa from an infant formula perspective, and globally brands like Dettol and Durex. And so we're heavily invested in people's health, their hygiene, that supports their health and their nourishment. And where we come from on this is that because that is our core business agenda, we increasingly see the impact of climate change on people's health and their day-to-day lives. And that's been our focus for the last 200 years of how the business has worked to try and generate societal activity, societal change through what we do as a business. And I think if society is to succeed, let alone if our business is going to succeed, then we have to find ways of tackling this planetary and public health nexus so we enable better healthcare solutions that protect people against the changes that they're facing and the challenges that they're facing to their health through climate change. And as you've heard, today, around about 13 million deaths are coming from environmental factors, air pollution, extreme weather, just changes in temperature, which we are seeing even in temperate climates, things that we didn't see 10 years ago, let alone 5 years ago. When the temperature in the UK gets above 40 degrees, the UK doesn't know what to do, and that happened this summer. And so what we're trying to do is think about how we perhaps both minimize the impact of those changes on people's lives, but also prepare for the public health burden that is inevitably coming through climate change. And I think we have to combine both preventative measures with better climate-aware health systems and infrastructure so that we can combat those changes through what we all do in our day-to-day lives, and from the point of view of Reckitt, so how we combat it through our own operations to reduce our climate change impact, to enable people through better innovative products to protect themselves through self-care, and also therefore reduce the burden on the formal public health sector, and certainly to help people using our brands around the world to take small actions that protect themselves and contribute to combating climate change. And this is an investment in people, and it's an investment in all our futures. I heard Dr. Mohamed Pate yesterday from Nigeria talking about if healthcare to this type of degree was funded, you're talking about translating to $2 trillion per year in GDP growth. Now, if you needed a business case to think about how you bring this planetary health and public health nexus together in the climate change conversations that are happening here in New York today, $2 trillion a year is the strongest business case you're going to get. But frankly, because this is about people's health, people's lives, people's families, you don't need a business case. It's something that we have to be invested in for the future of society, and that's why Reckitt is part of that. And we started this conversation in Glasgow last year. We're continuing it in Egypt this year at COP, and we'll continue it again in COP next year in the UAE. Because I think if we do not bring climate change home to this personal level that is affecting millions, billions of people around the world, then our ability to tackle climate change is fundamentally flawed.
Thank you, David. And that reminds me of one of the insights that we had at the beginning of this journey, which is bringing health into the climate change conversation actually does really personalize this agenda in a super helpful way. Thank you for that. Una.
Oh, hi everybody. I've only been here just over 24 hours, so I haven't lost the edge of my Glaswegian accent, so bear with me. Yeah, so I'm from Walgreens Boots Alliance. Many of you will interact with either a Walgreens store or a Boots store. You'll know us. We're a global healthcare-centred company with a healthcare-centred ESG strategy. We've got about 315,000 employees around the world and 35,000 pharmacists. My remarks today, I'm going to think about through the lens of the role of community pharmacy and the role of Walgreens and those 13,000 pharmacies we have all around the world. I think we've talked for over a year now about the intersection between climate change and human health and that the irrefutable evidence that exists. And I think it was very recently that the UN General Assembly said that a healthy planet is now a human right. And I think that's really key when we think about it, because the detrimental impacts of that affect our planet do every single day affect humans and human beings on it. As a pharmacy-centred business, we have experience of the impacts through a number of lenses, and you've heard a couple of them spoken about, whether it's around air quality and asthma. 300 million people around the world suffer from asthma. And ironically, in the UK, about 3% of the NHS carbon footprint comes from inhalers. Yeah, and so there's some really, really interesting correlations there. Another way that we operate and support the communities that we serve is in support of people living with cancer, and we have some incredible partnerships there. And it's now estimated in the UK that 1 in 10 lung cancers are as a direct consequence of poor air quality. The majority through smoking, but 1 in 10 are now directly correlated to poor air quality, which is really, really striking for me. I think also when you look at the lens of the health of the planet, the health of society overall, you know, we've all been vaccinated. We've all had most of us have. We've all had the experience of COVID and vaccinations, and you can imagine with an organisation like ours, we have now provided something like 62 million vaccines to people around the world. But that belies another truth, which is in the last 12 months, 25 million children have missed critical vaccines, and 18 million of those children have never had a vaccine in their life. And those vaccines prevent diseases like malaria, polio, and measles. And for the first time in a decade, polio has actually emerged here in the US and also in the UK. And so when you think about the social impacts of what we're doing to the climate, the social impacts of what we're doing to human health, you can see the key role that when you're living and breathing within the communities that you serve, you can really, really bring a lot to the table. And I guess the thing that I would say is, why are we part of this coalition? I think Her Majesty the Queen, rest in peace, she really, really at COP26 talked about how by coming together, we can triumph over the greatest adversities. And it's that sense of partnership, that SDG Goal 17, that's always been at the heart of what Walgreens Boots Alliance is about. And we work with these amazing partners because we see the role of community pharmacy, both through the lens of supporting those people living with the effects of air pollution and climate change, but also how, like David said, how we get into and onto a preventative front foot and really help people overall realise their full potential and their overall well-being. So that's why we are part of this, and we are very proud to be so.
Thank you very much. So I hope that gives you an insight into the motivation of the four partners and gives you an insight into the potential of this coalition. Air quality was one of the case studies we used in the original guidance to show the links between action on, in this case, air quality, greenhouse gas emissions, yes, improves air quality, also improves determinants of health. So there are multiple intersectional points where private sector action can drive these dual benefits on climate and on health. So that's why we have formed the coalition, and you can hear from the partners, they all bring something amazing to the coalition in terms of their brands, their reach, their skills. So what have we been up to this year? Well, two things. We're busily working on updating the guidance and also building out the call to action, both of which will be published around COP27. Even though there isn't a health day at COP27, we really want to keep communicating the real urgency of looking at climate and health together. And so in order to update the guidance, we have been doing a big scan of the literature on climate and health, and have had some support from Johnson & Johnson to do this through two of their employees. And I just wanted to share a few insights from that research and then ask for reflections from Josh and then from Kate in terms of sort of reflections from a policy perspective and also a broader enabling environment perspective. So what has the research told us? Well, number one, even though David just articulated a really strong business case for tackling climate and health together, if you go out broadly into the private sector, that business case is just not clear at all. That's really one of the headlines we found from our research. And we've hosted a number of conversations over the summer with the tech sector, with the food sector, and awareness also of the links between climate and health amongst parts of the private sector outside of perhaps food and healthcare isn't perhaps where it needs to be. The second and linked insight is access to finance for really driving change at the climate and health interface is limited, particularly in low and middle income countries. We're also seeing, though, and this is a cause for some optimism, an attempt to integrate the H into ESG. There's some brilliant work being led by L&G Investments where they're looking at what happens if we integrate requirements for health into ESG. So not that you needed another acronym, ESG and H is on the horizon, which I think is really interesting. Number four insight is, whilst there is policy interest in this intersection of climate and health, there isn't a huge amount of action, and I'm curious to hear what Kate might say about that. There's also, over the last 12 months, been a lot more interest in the role of the private sector, and so a number of collaborations are emerging, and so it's really important that we try and seek alignment because this is such a high potential area for change, and so that's why it's great that we're able to work with WBCSD and others in delivering our objectives in this space. And then our final insight, let me just check, yes, is there's such an opportunity for deep engagement with philanthropy, with investors, and not just policy, purely because the level of capital that's going to be needed to inject to drive these solutions at scale is enormous. And so one of the areas we're going to be exploring within the call to action is very specific ask of the investment community and also philanthropy. And that's why it's great to see organizations such as the Wellcome Trust getting more interested in this space. So some insights there. I'm just curious to know, Josh, from your work, do they resonate?
Yeah, they absolutely do. And you know, just to zoom out for a second here, while there's a lot of movement around climate and health now, and the coalition is a great example of that, the health sector is really late to the party when it comes to climate change. It's only been in the last several years that the health sector has begun to mobilize around the issue. And at the same time, what we know is that healthcare contributes to 4.4% of global greenhouse gas emissions. So the sector is a major contributor to the problem. And we're starting to see action now, both from the public sector and the private sector. So last year at COP26, more than 60 governments committed to healthcare decarbonization and resilience, ministries of health. This year, the G7 reiterated that commitment. So all of the G7 countries are saying we've got to decarbonize our healthcare sector, which means regulation is coming. Transformation is coming from the national government level. What does that mean for the private sector? It means that the private sector can either get out in front of this and lead, or it's going to be responding to that government action. Now, of that 4.4% of net global emissions, 70% of it comes from the supply chain. So that's a huge amount of pharmaceuticals, medical devices, food, transport, investment, all of it, right? And so the supply chain is a key part of transforming the healthcare sector. And at the same time, healthcare provision, about 40% of it around the world is also private sector. So the private sector has a really, really important role to play in reaching net zero emissions. There are a series of initiatives out there like this coalition, like the UNFCCC Race to Zero, which Bupa is part of, and Healthcare Without Harm is leading the healthcare part of it, where we're getting hospitals and health systems around the world to commit to net zero emissions. And what, sitting here on this panel are some of the leaders, but what we've got to do is bring the entire sector along, and I think that's the key challenge.
Thank you. And Josh, I just want to say, I know Gary couldn't be here today, Gary Cohen, but I just wanted to personally thank you and Gary for your leadership in this space, because it was you and your organization that really shone that light on that big impact of the healthcare sector. And you've just been doing some tremendous work around the world. So just thank you.
Part of a global effort, and a network of folks in Healthcare Without Harm all around the world who are doing this work.
But check out their website. They do some amazing work. So turning now to the perspective of someone that sits in the heart of government, in the Governance Office of New Jersey, in terms of the insights from our work so far this year, Kay, again, do they resonate? Anything missing?
Yeah. Well, I certainly won't dispute insight number 4, which is that more policy action is needed. I will say that at Governor Murphy's Office of Climate Action and the Green Economy, we're sort of charged with achieving the state's goals around a 80% emissions reduction from 2006 levels by 2050 and 100% transition to clean energy by 2050. And I always caveat that last one by saying that we will be about 89% of the way to that clean energy transition in New Jersey by 2035. So much more in line with the federal goals, as well as the timeline that we know we need to be able to mitigate some of the worst impacts of the climate crisis. Having said that, there are 3 people in my office, so small but mighty. Of course, supported by a tremendous number of experts at the sort of state agency level, but we are, as my fellow panelist Josh alluded to, really inundated at the state level with the highest level of investment in climate action in federal dollars that we've ever seen. And so it is certainly still not enough, but states are really struggling and working to align and catalyze and maximize this opportunity that's presented by the federal investment in climate action in a way that is most impactful. And I think what we really need from the private sector are, one, to sort of demonstrate best practices and model that sustainable practices, sustainable development, support for the growth of the green workforce and access to opportunities in the green economy for environmental justice communities is really possible. And, two, to really help us to catalyze private investment with these federal dollars, right? So really look for opportunities to be able to leverage this unprecedented moment where we have a ton of infrastructure investment that frankly could go in the direction of just building more roads, right? And unsustainable investments from a climate perspective in our states, with the kind of incentives that are coming out through the Inflation Reduction Act, which are mostly to kind of consumers and businesses to be able to incentivize those climate actions. So there's a real opportunity here, and I think we need the private sector to lead and to help us to catalyze and really take advantage of the opportunity.
Thank you for that. And it's both reassuring and slightly alarming of this moment in time, right? So lots of private sector, and government capital going into this space. The opportunity to actually make the right policy interventions and drive co-benefits, but equally a risk that expenditure might not quite deliver. So super important time then to be having this conversation. And thank you again for taking your time out of your schedule. So that's just a few more insights into where we're headed with the research. We're now just going to move on to just sharing a few insights from the updated guidance, reflect on the call to action, and then if we get a chance, take a few questions from the audience. So moving to the updated guidance, Una, how will the updated guidance build on the original guidance we published this time last year?
Thanks, Sally. So the primary focus of the previous guidance was thinking about that intersection between climate change and health. And the switch up that we're making this time is really looking at it through the lens of climate change and health equity. And thinking about how, we realise the ability of the least vulnerable in society, who are the most affected by climate change but contribute the least to climate impact, how we have a fair and equitable solution for everyone. So really, that's the major switch up that we're making. And I reflect on it through, again, the lens of the organisation that I work for. Last year, we announced a $5.5 billion investment in thinking about changing up the US health care service that we provide. We've made some strategic investments in organisations including Village MD that are a community-based doctors or GP surgery. That's the UK version of it, MD surgeries. And we have them attached to our Walgreens pharmacies now. And so you can imagine the co-benefits of coexisting right there out in the communities. We've also had some strategic partnerships and acquisitions with organisations called CareCentrix and also Shields Health. And those organisations complement what we already do in the community pharmacy setting, whether it's through specialty drugs or ensuring care at home. And so by shifting up the focus on how healthcare is provided and the role of pharmacy at the centre of that, I think we are really, really driving that focus on health equity. Because we also recognise that, something like 52% of Americans that we currently serve through our pharmacies live in socially deprived areas, and that figure in the UK is over 40%. So we are working with those people who are in those greatest need. The research itself last year really focused on what we call Scope 1. There was 3 scopes and they complement the carbon scopes. Scope 1, which is from a healthcare perspective, our internal operations, how you make your internal operations as robust and resilient through the entire supply chain as possible. But this year we're adding in 2 further scopes. Scope 2, in thinking about the impact of and the access to your services and your products. And Scope 3, which is the impact that you have on the communities you serve. And so looking through the lens of those 3 scopes from a healthcare perspective, but then also, as Sally said, we're looking at the broader, 3 other broader business areas, which is the built environment, food, and, I've forgotten a blank. Technology, thank you. So I think the guidance will be, really doubling down on that idea of driving not just through the lens of climate change and health, but really driving through the lens of creating equitable and just access to that health.
Thank you very much, Una. So we're really excited about this updated guidance because we all know of the need to integrate the E and the S. And we're hoping by going deeper for food companies, for tech companies, for built environment companies, we can unlock their disproportionate potential benefits in this space. But we also are still going to continue to go deeper with the healthcare sector to recognise, again, a sort of potentially disproportionate positive impact on this nexus. And so, Henri, can you give us a little bit of insight into how we're developing the guidance for healthcare businesses, please?
I also wanted to go back to your point of making sure it's ES, H, and G, or bringing health into the societal goal. So we have decided to create an impact goal in the S, with impacting 50 million people with better opportunities for everyday health care. Because you can't, you've got to put this, you've got to put good plans in place in ESG, because that is really the driver. It's the driver for companies, it's the driver for shareholders. People look at that, and you want to make sure that you make that part of ESG. So we have made that commitment for 50 million by 2025. As well as you've got to get your own house in order. You've got to mitigate what we're, the products that we're building, to make sure that we're building them as sustainably as possible. So really helping to mitigate with scope 1 and 2 and scope 3. And I think the helping people adapt, because you really have to help people understand causals and why they're feeling bad, and we have to make sure that we really educate the public about breathing. We've formed some coalitions with the Clean Breathing Institute to really go out and talk to kids and adults about clean breathing and things that they can do to help their health. And so I think it's those kinds of coalitions with NGOs that will really make a difference in having companies work with them. You can never do it alone. You've got to do it with people that, that's their raison d'etre. So I think mitigation and adapting is really where companies can come into play.
Great, thank you. So a lot more guidance to be shared as we progress the guidance for healthcare players. But Glyn, just sticking with the updated guidance, if I may, before we move on to the wider call to action. As Bupa, I think you're in a very interesting position. You're contributing to the guidance and acting on it simultaneously. So one of those classic, we're building the aeroplane while we're flying it kind of moments. So how are you acting on the emerging guidance as we're developing it?
Yeah, thanks, Ali. It's a great analogy, I think. So just stepping back ever so slightly. So I mentioned earlier that we've kind of tweaked our sort of purpose. We're an organization, I didn't mention this earlier, but we're an organization without shareholders, which is slightly odd. We are for profit, we're not a not-for-profit. So therefore, all the profits we make, we basically invest into how do we kind of cater for our customers better. We have about 38 million of those. And so we said, well, when we look at our purpose and how we tweak it, and we recognize that we have to kind of go beyond just sort of healthcare. It has to be around this intersection with planet. And so then we sort of started to think about, and this is where the guidance is really helpful, I think, looking at the areas of influence. And it's been said already, but we have to start with our own house. So we sort of said, well, when we think about our strategy, which is actually very aligned to the guidance, and that is by accident rather than by design. And I think there's a piece around starting with your own house. How do you make sure the impact of the delivery of healthcare, which we've already heard has a huge impact in terms of even just GHG emissions, how do you make sure that is delivering in a way that doesn't impact, the sort of adversely impact the kind of the wider goal of looking after the planet? And so we set a net zero ambition, so we're going to be net zero by 2040. That's underpinned by science-based targets, and we're kind of on the road to do that. I think one of the things we recognize, however, is when you look across our emissions, 98% of our emissions sit in scope 3. That's probably not dissimilar to a lot of organizations, but for healthcare, that's an incredibly complex challenge. And whilst we can decarbonize our own operations and put in heat pumps into facilities, et cetera, influencing our supply chain, which includes healthcare providers around the globe, with whom we may or may not have contracts, volume contracts, is an incredibly challenging thing to do. We also need to look at kind of how we procure goods and services, and we do that on a global supply chain level. And so that is a piece which we really are sort of thinking about. How do we really start to do that? And so looking across those two scopes of influence, the first piece we recognize is that delivering healthcare in a more sort of environmentally sustainable way, digital is one pathway to doing that. So we're taking sort of our initial steps into really digitizing the delivery of our healthcare, but not just doing that to sort of improve our own emissions, but educating the customers we have in this is why this is a good thing, you know. And that is something we've done in our Europe and Latin American businesses quite successfully, and we're rolling that out globally. It's around this sort of, it's an app called Blua, but essentially what it does is it's a digital consultation app. So, you know, video consultations, it's not dissimilar to some of the other apps you see from the NHS, for example, and other companies. But what we've also said is built in a kind of carbon trust-backed carbon calculator, which basically says to the customer, you know, by taking your your consultations over a video conference, you've saved X amounts of carbon. Also, you can get all of your prescriptions and your reports and everything else delivered digitally or electronically, and that saves further carbon. And what that's really doing is about changing behavior. So people don't feel the need to sort of jump in cars, which they do in a lot of our territories, to drive to a clinic and get treated, et cetera, et cetera. So you can do that digitally in many places. And then when we look at across our value chain, you know, how do we start to sort of really shape and influence the way that we deliver for our value chain? That's quite a complicated conversation. But innovation is a key part of that. So we recognized that we needed to do something to sort of really drive innovation. And that's both internally and also externally. You know, not all the solutions we have come from our own business. Coalition partners are really helpful in that space, but also, you know, there are loads and loads of startups in the healthcare space who are tackling particular challenges which we can incorporate into the way we deliver for our customers. And that is something we've identified as a real need. So we've set up a program. It's a relatively small program, essentially kind of a mini incubator, if you like. Again, lots of organizations do this, but for us, we're really focusing on the healthcare, and it's aligned very closely to our strategy. And so how do you kind of really sort of deliver for our customers? And Eco Disruptive is a program we run where we basically say to our staff, go and find solutions. You know, you have a broad topic, go and find a solution, figure out how to do this, present an MVP, we'll decide on it, and then essentially the businesses around our businesses will decide, that's quite a good idea, why don't I implement that, how do I scale it up? And that scalability is a real challenge at the moment. We did this last year, it was extremely successful, and we're scaling it up at the moment in Spain, and we want to take that globally. And so making sure that we have the kind of pathways and the investment and the funding to kind of scale these kind of solutions is hugely important. I think then there's a kind of a broader piece around leading by example, if you like, if I can say that, around sort of demonstrating to other people that these solutions are possible and talking about them, advocating for them, you know, and educating people around kind of what we're doing. And that's a critical part of our kind of that kind of influencing other strategy, influencing our value chain, our broader stakeholders. And then I think there's a kind of a recognition that that's largely about doing things better, doing less harm. We also need to recognize that we need to do more good. As a healthcare company, we're not specialists in any way around regenerating and restoring natural ecosystems. And we understand this interconnection between natural ecosystems, good, healthy natural ecosystems, and human health. And so we need to be able to sort of figure out how do we implement solutions for our natural ecosystems. And that's the kind of the third pillar of our strategy, is around how do we kind of deliver for health, how do we change behaviors for customers so that they can use natural ecosystems to improve their own physical and mental health, but also how do we make sure that the natural ecosystems are catered for or are looked after to make sure that they preserve, and we've heard this point already, people's human health. And that's the kind of the third part of our strategy.
Thank you for that. So you just got some insights there into the actual guidance, and we will be going deeper than we did last year on how to deal with Scope 3 emissions, because it's a challenge that every business face. And we also will be including some cases. And we included Eco Disruptive last year, and hopefully we can give an update this year. So the guidance is practical guidance, but lots of case studies as well. And some of you in the audience have also supplied it with some, so thank you for that. So that's the guidance. The last kind of segment of the conversation now is going to focus on that wider call to action. To really unlock the potential of the private sector, we clearly need to pull other levers in the system. So I'm going to go to David now, because I know David likes a bit of policy. I've known David for a very long time. So David, in terms of that broader call to action then, what do we need to see from policy makers, and how is Reckitt approaching influencing policy?
I think I should say thank you, Sally. That was a bit of a left-handed compliment. I mean, the top and bottom of it is if you're not engaging with the policy conversation, then making this stick just ain't going to happen. And I think what you've heard already today is this theme of better public-private partnership in order to deliver stronger formal public health care, stronger formal private health care, and particularly from a Reckitt's perspective and Walgreens' perspective, I think, as well, stronger, better enabled self-care and health literacy. And yet the trouble is we've been talking about better public-private partnerships for the better part of 20 years, and we're not always there yet. But we need to work faster on this because this is now personal, as I was saying before. And I think we can draw on lessons that we've seen and taken from other non-communicable disease conversations, diet and obesity and health coming through that, where we start to see this combined cross-sector, and I don't just mean public and private, I mean public, private and civil society cross-sector conversation to drive change. Because that's starting to create stronger push for behavior change, stronger senses of, in this case, health literacy, that gets messages through much more powerfully and more consistently, and hugely importantly, with better scale. Now, if you want some really strong policy points, of course I'm going to give you a list. The list is as long as my arm, but I'm going to focus on just a few things to really, I think, that would drive change. First and foremost, I think we have to see how we better mainstream health into climate change and biodiversity agendas, and how we fund health programs within that around UNFCCC, as Josh was saying earlier. Because if it is not mainstreamed, then this premise that climate change is becoming a personal issue does not translate through, unfortunately, to what people see in action. That then also leads you to how do you better integrate health assessment into all development project appraisals, and how do you implement safeguards that give attention to that acute and long-term lasting health impacts. And that then helps you also to better assess and quantify the health co-benefits of all of the environmental investments that are happening now. You know, the 130 trillion that was talked about in Glasgow has health benefits within it. Go back to what I was saying earlier about the 2 trillion per annum that Dr. Pate was talking about in terms of the benefits. How do you link these together more effectively in the policy dimension and the debate to drive consistent change? And that then, I think, finally sort of takes you to a question of how do you support widespread access to and behavior change around uptake of individual self-protection and risk reduction measures that lessen that impact of climate change on people's health and lives? How do you really, really make it personal? Because if you can do that on health, you will also do it on other aspects of climate change action and persuade people that everything that we do, from, as we said in Glasgow, washing your hands in cooler water, turning the dial down on your washing machine, has a lasting impact. And when you make it personal, people make changes. Sometimes, in many parts of the world, climate change still feels remote. It shouldn't do when we see the extreme weather that we're facing, but it still feels remote. When you make it personal, you create change. So in terms of Reckitt and how that takes forward from our point of view, what are we doing, how are we influencing, how are we engaging? I've said it already, being at COP and driving that conversation through to the UAE in 28 is critical. And the good news is, if you haven't heard it, there is a health day at COP in the UAE, which is a significant step forward, significant, because it's joining the agendas up. One of the other things that we're doing is framing our impact in terms of how health outcomes play through and how you translate what promoting health literacy, selling, promoting products, and bear in mind, we put 20 million products into we put products into 20 million households every day. And that's a huge responsibility for creating conversations with people about how they generate self-care, how they act on climate change, how they protect themselves, how they remember to turn the dial down on the washing machine. And I don't do it all the time because I'm of an age where washing machines weren't that clever 20 years ago. And so how we can do that and then translate that into economic contribution that changes that dimension in that discussion at COP is critical. If I take a brand like Durex, in one market alone, we know that the net positive contribution is round about $130 million every year because of improved health benefits from sexual health and well-being. Translating our overall impact into health numbers like that changes the dynamic of the conversation. So that's the second part of our influencing thing. It's also about delivering brands that make that impact happen in people's homes, for their lives, and working to persuade them and engage them in that health literacy conversation. If you don't know how to do something, you don't do it. It's fairly simple. And that's a hugely important part of our work and a huge area of responsibility for us. Last but by no means least, it's also about delivering on our own climate change commitments. We do not have a mandate to talk to people about what they can do if we are not delivering on our science-based targets, if we are not progressing towards our net zero goal by 2040, and if we're not making those changes in our brands, in our supply chain, in the communities where we work in order to make that happen. And the good news is we've already hit one of our science-based targets for 2030, 9 years ahead of schedule. But it's not enough to stop there. You've got to keep going. We have to keep that happening, and we have to build awareness around that. And as one last plug, we have a wonderful new project that if you want to come and talk to my colleague Hamza, who's at the front, about NFTs. And there's a fantastic artist in Africa who we're working with who has developed an NFT that you can, don't ask me how all this stuff works, it's tech beyond me. But it is going to support the development of health entrepreneurs in Africa to drive primary healthcare delivery to help really meet some of these challenges of climate change that Africa sees especially. So come and talk to us separately about that, because that's about building awareness about how this is impacting people's day-to-day lives. And when you roll all those things together, your ability to influence and drive and contribute to that policy agenda to make that public-private partnership around health becomes much more feasible, I think.
Thank you, David. Thank you for the very strong recommendations on policy there. That's part of a call to action written. Thank you so much for that. NFTs, for those of you that are like me, didn't know what that was until 6 months ago, non-financial transactions, just, non-fungible. Oh, tokens. So still don't know. That's the last time I try and clarify anything on that front. So where were we? Yes, 2 more questions. So we're sticking with the theme of the call to action, and I've got one final question for Kate and then to Josh, if I may. So Kate, at a government level, what policies do you think are needed, and what are you doing in your office?
So this conversation has been so wonderful, and it's so great to hear sort of the not only the actions, but also the policy expertise in the private sector that I think really needs to be leveraged more effectively. And I think that oftentimes what sort of policy makers like myself are trying to do in our day-to-day is to make not only the economic case for climate action, but also the political case for it. And so, I'll sort of circle back to the opportunity that's presented by all of the federal funding that's on the table right now, and give a specific example, I think, of a policy that, is a real opportunity for leveraging and intersecting with action from the private sector, which is there's about $8 billion on the table right now for the production of clean hydrogen, which is hydrogen that is produced from renewable energy or the harvesting of electrons from nuclear energy production. And that money is being dispersed nationally through the Department of Energy right now. So that presents a tremendous opportunity to do a lot of innovation, right, around decarbonizing the heavy to medium duty transport sector with fuel cell technology and other things like that. It's really could be tremendous. And in New Jersey, we really take sort of a technology agnostic, innovation, supportive approach to our clean energy transition. So as long as it meets the criteria of reducing our emissions profile, and filling a gap to where we need to be in our energy transition, that's something that we are certainly willing to consider from a policy standpoint. However, there's a tremendous amount of risk around the clean hydrogen opportunity specifically, which is that states take on or communities take on the combustion of hydrogen in housing, which has a higher emissions profile, higher nitrous oxide emissions profile, and really runs the risk of leaving low to moderate income households on a natural gas infrastructure that will just continue to become more expensive. It has real health implications for folks. And so, that's a real place where I could tell you that, engagement with your policymakers is critically important, because what's coming into state and community energy offices right now is a lot of incoming around we should combust hydrogen. This is a measure that will decarbonize the natural gas sector. We need the health voices at the table to say the nitrous oxide emissions profile is actually higher for this, right? We need folks to sort of really approach this from a health standpoint and be that voice that could help policymakers like myself make the case from the climate perspective. So that's just one specific example. I think the other thing, and I sort of took this in the other direction, which is what the private sector can do for us. I'll circle back to policy in just a moment. But I think the other thing that I keep thinking about in today's conversation is really developing this ecosystem of knowledge and innovation in the green economy space. So everything from the private sector helping to develop curricula for K-12 and beyond to help to develop that green workforce, to really supporting innovation. And I can tell you that specifically in New Jersey, we're very interested in supporting Black and brown startups, led and owned startups, and innovation in the communities that we serve in the environmental justice space, because those are folks that don't have access to a lot of the kind of supports that are needed at the startup level. But there's a tremendous amount of incredible innovation coming out of these communities. So that's another place that's really ripe for engagement. I think our role as policymakers, as we see it in New Jersey, is really to, one, as I said, kind of set the stage for innovation and try to work closely with our private sector partners to leverage your interest in your investment to move things in the right direction, to take from the examples of the best practices that are happening in the private sector and translate those into policy, but also to sort of set the guide rails, right? So to keep the price of renewable energy credits and carbon emissions stable so that folks can make an investment in this space and understand what that incentive or return is going to look like. To ensure that we're not unintentionally doing things like, the example I just mentioned that do have a health impact, even though they may transition us to a lower emissions profile. So I think that's, really where we sort of see ourselves as coming in and then looking to you all to help to lead us in the direction of climate action.
Thank you, and that's wonderfully tangible and something that we can really shine a light on in the report. So thank you very much, Kate. Josh, last question, no pressure. Having heard all of that and knowing what you know about the potential for transformation at the intersection of climate and health, what else needs to happen to create that enabling environment for the private sector?
Wow, okay. So
in 3 minutes.
Maria Neira, who leads the environmental work at the World Health Organization, said when the Paris Agreement was signed, this is the most important health agreement of the 21st century. And she was right in a lot of ways. And from that flows a whole universe of activities that need to happen to make that real. And those activities really come together under the sort of fundamentally interconnected challenges of both achieving health equity and achieving zero emissions, climate resilient health sector, and decarbonizing our society and our civilization. And so, there's maybe three things. First is in terms of achieving that health equity with low carbon solutions. It means providing access to energy to health centers all around the developing world that have no access to energy. There are millions and millions of people who don't have access to care because there is no energy to power the health centers that may be miles away from them. And so the challenge is then creating a zero emissions health sector that provides that access to care there. It means providing access to care to low-income communities of color who have unequal access to care in this country and in many other developing countries as well, in a way that is sustainable. So sustainability and equity need to go hand in hand. It also means transforming how care is delivered and how products are produced for the health sector. And so we need to see more and more zero emissions, resilient, hospitals and health centers all around the world, as we've heard from Bupa they're trying to do. And nobody knows what it really looks like. There's a lot of rhetoric around this, but Lynn and I were talking earlier, there is no clear example of what a zero-emission health system looks like yet. There's a tremendous amount of aspiration. And then the same goes for what you all are doing. So how do you produce zero-emissions Advil or zero-emissions Lysol? And you guys did it with CFCs, right? Lysol used to be CFC delivered, right? And so it's possible, but it requires a tremendous amount of commitment and dedication and innovation and investment. And so that's the second piece. The third piece is really that forward-looking piece. It's about how the sector can actually lead and how the voice of health can actually make climate change both real and the solutions to climate change clear to people. And so it's about doctors advocating and nurses advocating for clean air. It's about hospitals and health systems and the doctors in them telling their patients about these issues and how it affects their health. It's about pharmacies and consumer product companies educating their consumers about these issues and providing pathways to action as well. And the private sector, as I said earlier, it can either lead on this or it can get dragged from behind to take action. And hopefully there'll be more and more companies like the ones on this stage that are actually leaders. Thank you.
Thank you, Josh. Brilliant way to end the conversation. And just to really echo, the ambition of the Health Coalition absolutely is to lead. When we first started this work, my big dream was, what would happen if every net zero strategy conceived by the private sector also had clear, tangible health benefits? Wouldn't that be amazing? Vice versa, every policy on health and well-being also looked at carbon emissions. And that's what we're trying to get to with this really practical guidance, knowing that actually to unlock the full potential of the private sector, we do need policy, we need investment, we need philanthropy on side too. And at this moment in time when we know we are facing a public health crisis, a climate emergency, I've never been more proud than today to have this conversation, because I think it's a conversation that's so important right now. And the work of the coalition is so vital in accelerating action at this kind of pressing interface of two of the most important challenges of our time. So thank you, lovely audience. Sorry you got a bit hot over there. You did very well. You've kind of been bathed in sunlight for the last half an hour. But thanks very much for coming along and listening. We'll be here for a while if you have any questions, but I'm just mindful of time. We started late. We have actually finished on time, even though it doesn't look that way. But do come and ask us any questions. And we will be sharing the film of the event, but please do spread the word of the coalition far and wide. We have big ambitions. We really do want the private sector to lead, and never has that been more important than this moment in time. So thank you all very much. Thank you all. You were wonderful and marvelous. Let's give them a round of applause.